done her vital signs, I've done her height and her weight, and her BMI. I've had her do the Snellen chart, so I have tested cranial nerve 2. I don't have that, yes, 2.
Yep.
So extra credit point, and her near vision. And now we're going to, proceed with the rest of the exam. So I'm going to come in the room, I'm going to do my hand hygiene and say, hello, I'm Barbara Richardson, I'm your nurse practitioner. I'm going to be doing a full head to toe physical for you today.
Okay.
And it is very lengthy and requires some different position changes. So let me know if you need to rest or take a break or do anything like that as we go through the exam.
Okay.
Right, and then I'm going to pull the curtain and arrange for some privacy.
Do you feel private?
No.
All right, so I know this sounds silly, but I'm going to ask you a few questions, just
Okay.
checking your level of consciousness. Can you tell me your name
Michelle.
and your date of birth?
May 25th, and I'm not going to say anything because they're all going to know
I'll
who
check on
I
the
am.
chart. So, where do you live?
Cleveland, Tennessee.
Okay. And do you know the date today? What day is it?
Today is November 15th.
Approximate time?
Oh, I don't know. Almost 10:30.
And where are you now and what are you here for?
I'm at Lee University. I am an instructor, and I am here to participate in a physical exam.
Okay, good.
Yeah.
So your level of consciousness is good. And I see that she has a pleasant affect, and her mood is happy, appropriate for the occasion. And let's see, her posture, she is sitting upright. She's not slumped or tripod. And let's see, her hygiene is good, and her speech is clear. So then let's move on to the head. So I'm going to be inspecting and palpating your head, if that's okay. And it is normal cephalic, and her skin is mobile, and there's no lesions or lice or nits or anything like that.
Oh, it's a good day for
It
head.
is a good day.
Yeah.
And I'm just going to check.
Now what?
You're going to get into my roots. I got it covered.
Is this your natural hair color?
Absolutely not.
Well, it looks natural. Who's your hairdresser?
Her name's Carrie Johnson. She's at Hairbenders. She's my mom.
All right, and her hair is smooth and soft, and everything looks appropriate there. All right, so now I'm going to look at your face, and it is symmetrical. The skin is smooth and normal color for ethnicity, and all your features are symmetrical. And I really can't remember all these. I don't want to miss anything, but okay. And then going on to the sinuses. So I'm going to palpate the maxillary sinuses. Any tenderness there? In the frontal sinuses? Okay, that's good. And then I'm going to look at your, check TMJ. So if you could open and close your mouth for me and move your jaw from side to side. All right, I don't feel any crepitus or there's no clicks. And TMJ, I'm going to check cranial nerve number 7. So if you'd smile for me, smile big, frown, show me your teeth, lift your eyebrows up, clench your eyes tight shut. Okay. And then we'll move on to the eyes. So I'm looking at your external eyes, and I see that they are symmetrical. Palpebral fissures are symmetrical. You don't have any lid lag or ptosis or exophthalmos. And I see the sclera is white and the cornea is clear. All right, so let's look at your pupils. All right, so I'm going to check this pupil and it constricts, and then look at the other pupil and it constricts also. And then this side, it constricts, and then on the other side, it constricts. So she has direct and consensual constriction of the pupils. And palpate the sac. I didn't see any swelling, no tenderness there, no drainage. All right, now I would like you to take a look at this pen light and then follow it with your eyes as I move in towards your nose. Okay, and back out. So her pupils constricted and converged. So I can say that I can document PERLA, pupils equal, round, reactive, and to light and accommodation. All right, so then let's look at extraocular movements. So I'm going to go through all 6 fields of gaze, so just follow my finger with your eyes. And off to the side. Down. Okay, your movements are smooth and coordinated, no nystagmus. So that's testing cranial nerves 3, 4, and 6. So then we can move to the ears, and I'm going to just look first. I'm looking at the pinna, the arcle, the pinnacle, the lobule, and they are normal color, no lesions. I don't see any drainage or discharge. And then I'm going to just palpate here. Do you feel any tenderness? And on this side? Any tenderness? Okay, and then I want to palpate the tragus. Does that hurt at all? And the mastoid. Any pain there? Okay, good. And then I can look inside your ears.
I'm sure they're great.
All right, so this is a little hard in this because it's attached to the wall, but pull up and back. Brace with this hand. And her external auditory canal is nice and pink, no lesions, no cerumen. The tympanic membrane is clear, opaque, and I see the light reflex at 5 o'clock. No bulging or retracting, no redness or drainage. Brace it. Same on this side, the external canal is nice and pink, no lesions, no drainage, no cerumen. It's got a little bit of redness in the upper part of the tympanic membrane, but I see the light reflex at 7 o'clock. And I can see the bony prominences, so no retractions or bulging. Let's check your hearing. I'm going to say, whisper 3 words and I want you to repeat them, okay?
Popcorn. Football. Pencil.
Okay. And other ear.
Hammer.
You should come up with 6 words ahead of time.
Table. Puppy.
Aww.
Good. So she's got good hearing, so that we don't need to do any further testing with that. All right, now I'm going to move on to the nose. So I'm going to look at the external part of the nose, and I see nice and symmetrical, same color as the rest of her face, no lesions, no drainage. And then I'm going to palpate it. Do you have any tenderness there? Okay, so no tenderness. And then I want to check the patency of your nares. So if you would occlude one nostril with your finger and sniff in. And then the other side. I can't hear you. Are you breathing in?
Yes.
I couldn't hear it. Okay, good. So nostrils are patent. And then I'm going to check inside the nose. So I know this is awkward, but I'm just going to look inside here. And I can see the inferior and the middle turbinates. The septum is intact and midline, and there's no drainage. This one looks a little swollen, like maybe you have some allergies, and a little bit pale and kind of boggy. So, alright. So, let's see. Forget anything yet? Moving on to the mouth, I'm going to put on some gloves. Doing okay so far?
Mm-hmm.
It's a lot.
It is.
It's a lot. Alright, so first I just want to look at your lips, and they are symmetric, moist, no lesions. And then if you would, let me see your teeth. Okay, so the teeth are evenly spaced and white and in good repair and good oral hygiene. Then I want to just look at your gums here. So I'm just going to move this one to the side and check your gums. And those look well adhered to your teeth. All right, open your mouth a little further. I'm going to look at the sides of your mouth, the buccal mucosa. And that looks pink and moist, no lesions. All right, now if you would stick out your tongue for me, just stick it out straight. And it's midline, I see no fasciculations. Now stick out a little more, say ah.
Ah.
Again, ah.
Ah.
Okay, on this side. Ah. Okay. Did you have your tonsils taken out?
Mm-mm.
Okay. So the tonsils are not visible. I grade them as a 0. The hard and soft palate rise symmetrically along with the uvula when you say ah. And have rugae present on the hard palate. And so, tongue strength. I didn't palpate the tongue, but when you have your gloves on, you could palpate and see underneath. Let me see the underneath part of your tongue. Say ah, ah. Okay. Now, if you would push on your cheek with your tongue, and let me feel. There you go. Another side. Good. So good tongue strength. All right. Neck. I'm going to inspect your neck. And it's midline and symmetrical. I don't see any enlargement of the thyroid. Skin color is good. I don't see any lesions. Let's see, trachea. I'm going to palpate the trachea, which is midline. Okay. And then I want to check the range of motion of your neck. So if you would turn your head to this side and then the other side. And then chin down to your chest and back, and then ear to your shoulder, ear to your shoulder. And I'm going to do the same thing while giving you some resistance. So turn your head towards the side my hand is on. Okay, good. And this one, good. And go up, okay, and down. It's a little, and then tilt your ear to your chin. So she's got full range of motion of the neck and good muscle strength in the neck. Okay, and lymph nodes. So palpate your lymph nodes. So the preauricular and the postauricular, the occipital, the cervical, that's the posterior and anterior, supraclavicular, and the tonsillar, the submandibular, and the submental. All right, and I don't feel any lymph node enlargement. Did you have any tenderness in any of those areas? Okay, good. And so let's move on to the musculoskeletal system. All right, hold your arms out for me and let me look at them. So her skin color is normal. She's slightly tanned, normal for ethnicity. I don't see any lesions. And her temperature is warm and dry. Do you have any tenderness anywhere? I'm pressing on it, and I don't feel any masses. And I'm going to go ahead and just push up with your shoulders. Do your shoulder shrug. Okay, good. And I'm going to palpate your shoulders. any tenderness there, and they are symmetric and no crepitus. And then same with the elbows and the wrists. And then I want to do some range of motion with your elbows. So if you could bring them up and then down and then inward and out. Okay, let's do that with me pressing against you. So come down, bring your elbows up and down, out to the sides, forward. Same with the wrists. Go inward, outward, up, down. Okay, and then do it while I'm pressing against you. Outward and inward, and then up, and then down. Okay, good. And fingers, if you would spread them out and clench them. And then do it with me pressing against you. So spread out your fingers. Okay, and good. All right, so good muscle strength, range of motion, and all those. And let's do your pulses. So I'm going to check your brachial pulses. Those are symmetric, about +1. Radial, symmetric, about +1. Okay, capillary refill. It is immediate, less than 2 seconds. Sounds good. All right. Let's see what we got here. There's no clubbing of the nails and smooth texture. All right, let's do, we're gonna test some of your brain function. So I want you to just put your hands on your thighs and then turn them over and then back. And then just do that going faster and faster. Okay, good. So that looks good.
This is your mom.
All right, so move on to the lungs. I'm going to, here I would inspect and palpate the posterior thorax. And then I'm going to auscultate. Now listen to your lung sounds, so take a big breath in and out with each placement. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Not getting dizzy, are you? 12, 13, 14, 15, 16, 17, and 18. Okay, it sounds good. No adventitious sounds. And I'm just gonna press a little bit on your kidneys and see if that hurts. So, any pain there? Pain there? Okay, good. And we move to the anterior thorax, and again here I would inspect and palpate it first, and then I'm gonna go on to auscultate. So if you would take some big breaths in and out, get them for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, how you doing? You doing okay? All right, good. So let's move on to do some skin trigger while we're here. And I'm just gonna pinch, and there's no tenting. It returns to resting. All right, let's have you sit back a little bit. I think we have the sinking,
Yeah, that one's the sinking one.
the sinking bed.
Just don't put a lot of pressure. You really gotta use a lot of abdomen.
That's not good.
I know it's really hard.
Lean back back just a little. All right, now here is where I would check her jugular venous pressure, and I would check the carotid arteries. So,
It puts you in a great position for the abdomen check.
eventually you'll be lying down, and right when we need you to. Okay. All right. All right, so we're gonna do the apical pulse. Let's find it right here.
You need one of those carjack roofs.
Apical pulse could be done lying down. All right, so the apical pulse is regular, and I get about a 60. Count that for a full minute. Okay, now you can be supine. I feel like I'm at 6 Flags. Shoot.
What a wild ride.
All right. I'm going to inspect the abdomen and note that it's just a little bit lighter color than the rest of her skin tone. And symmetrical contour, I'd say is slightly rounded, and I don't see any abnormal pulsations. I'm going to auscultate. And I'm going to be listening for bowel sounds in all 4 quadrants, starting in the right lower quadrant. So we have bowel sounds present in all 4 quadrants. I'm going to do palpation now. So tell me if you feel any tenderness anywhere. Feels good? I'm going to go a little deeper. I don't feel any masses or enlarged organs. Then we're going to move on to the lower extremities. So if you would just relax your legs here. And temperature is just a little bit cool, symmetric, nice and dry, moist, not too dry. And I'm going to check her hip joints. Any tenderness? And there's no crepitus. Crepitus in the knees and the ankles. There's no lesions. I'm going to check her popliteal pulses. Okay. Those are symmetric, about 1+. Going to check her and here we would check the dorsalis pedis. Her pulses are nice and strong. Right. Edema. Check for edema. So she's got no edema. And I would check for capillary refill on her toes. And that's brisk capillary refill. All right. So let's have you sit up. And we're going to check your reflexes. You could probably be on this side to do this. Oh, we've got pants on and everything. Lift your leg up just a little bit so I can feel that tendon. Okay, and bring it back down.
I have a confession.
You don't have any reflexes? Okay. put your hands together and squeeze. Let's see if we get anything that way. Nope, she's got no reflexes. Okay.
This happened in my other assessment.
How would you report that? Just no reflex?
Just say, unable to obtain deep tendon reflexes. And that's typical for the patient. All right, now here I go ahead and do the rest of range of motion exercises with the hips and the knees and the ankles. But for now, we'll move on. I'm gonna have you stand up. Ooh.
Damn.
Go slow.
Yeah.
All right, I'm just gonna look at her spinal curvature from the side and from the back. And she's got a normal S curve and her hips are symmetrical. And if you could bend forward and touch your toes.
Yes, girl.
And the spine does flatten out. There's no scoliosis. All right, go ahead and stand up. And then if you would turn and walk to the curtain there. Okay, turn around. Now walk back, or walk to the curtain now doing heel to toe. And then back.
Look at that gait.
Mhm. Yeah, so she has a normal gait. She's got good tandem walk. At this point, I want you to just stand still for a few seconds. Your hands at your side. Okay, and now close your eyes. And I should be making sure she doesn't fall over. Okay. All right, good. So she has a negative Romberg test. You can open your eyes. And then put your hands out to your side, and with your finger touch your nose, and then the other one, and then go quicker. And you close your eyes and do that. All right, good job. You can stop. All right, and that concludes the head to toe physical. You did a good job. Yeah.
I guess you passed.
Did I pass? Did I miss